This module discusses the physiological effects of sports massage on the body systems. This is probably the most important of the anatomy and physiology modules. And although in the handbook it's quite light touch, we're going to deep dive here a little bit more on what we think is going on. For too long, sports massage therapists have made claims that were untrue. Claims that we did things to the body or massage worked in ways where there was no evidence to prove it. So here we're going to touch on what's more likely to be happening and also focus on what we do know, the benefits that massage gives, even if it is still unclear as to why those benefits occur on a physiological level. Firstly, why do people come to see us for sports massage? Quite often, unless the client is injured, they'll be coming to us for pre-event or post-event work. They may have a big goal in mind, a marathon, a triathlon, or maybe a big match coming up. In the weeks and days, or right before the event itself, they may be looking to your help to keep them in top condition and help them prevent injury. But there isn't much research that says that we do that. There isn't research that says that we reduce injury by having massage pre-event, or that we improve performance. But psychologically, it can help your client prepare for that event and feel that they are in their best condition and ready for the event. Pre-event massage is so broad. As I said, it could be weeks, days, or minutes before an event. So when the event is, the type of event, and your client dictates what your treatment would look like. If your client, for example, is going for a short, sharp burst for a personal best, a 400-meter sprint, or a big lift, would you spend a long time massaging them? And would you focus on slow, relaxing techniques? Or would you look at more proprioceptive, more awakening, energizing type techniques? So duration of treatment, as well as treatment type, is key here. Remember, our goal is to help our clients, not hinder them. We don't want to start working at deeper pressures or for longer times than we've done previously, as we don't want our clients to have any unexpected reactions, like post-massage pain, for example. Post-event, same thing in terms of timeline. This could be working in a tent straight after a marathon, or this could be the day or weeks after an event. Straight after that event, by eliciting that parasympathetic response, we can help our clients get out of that sympathetic response that they've just performed under, helping them to lower their heart rates, slow down their breathing, and decrease pain levels. Now, research is limited in terms of how post-event massage will help with things like DOMS. And we will talk about this in more detail in our soft tissue injury and dysfunction modules. But at a psychological level and in the here and then, it can help desensitize tissue and make our clients feel good post-event. People may come to us for maintenance massage or injury prevention. Many people see massage as a preventative measure, but again, there isn't solid evidence that it does prevent injury. But what we do know is that how someone feels psychologically has an impact on their pain level and also on their range of motion or how flexible they feel. It can help improve proprioception, help them move better, help them achieve maybe technical aspects of movement that they haven't been able to do before. It has a mechanical effect on range of movement. It improves that range of motion, and that can have a knock-on impact on biomechanics. And again, we can see this reduction of pain. And this is about having an impact on the nervous system. We've touched on this across most of our A&P modules. And on the last weekend of your course, we will do a pain science module where we'll take that a step further and help you to start understand why it is our clients feel better and their pain reduces, if even for a short window following sports massage. Tension and pain. Again, people may not come to you for maintenance sessions, but they may come to you when they have tension and pain. They may not have an acute injury. It may be ongoing neck tension, ongoing back pain, for example. And But it doesn't just have to be for sporty people. That's one of those common misconceptions that sports massage is for sports people. It's for anyone who feels they have increased tension, increased pain that they would like to improve. Tension may be a result of limited range of motion, which we can help with in terms of our hands-on work, but it can also be from compensation or dysfunction in the body. Pain is probably the biggest reason for booking a sports massage. And also it's one of our biggest selling points because we can reduce that pain. But the key to getting long-term pain results for your clients is integrating pain with also their knowledge, their understanding, their mindset, and also the right exercise and strength work. No one thing gives the answer to long-term pain solutions. But it's important that you understand the role that sports massage plays. By creating these pain-free windows, we get our clients moving more and feeling better, and that can be what kickstarts that sequence of events that leads to those long-term results. So now let's talk about the physical effects of sports massage. What do we know that sports massage helps with? Where is there science and where does science lack? So there are many studies that show that sports massage can increase range of movement. Now, this has many benefits. For example, if someone is restricted in a plane of movement, it can lead to compensation patterns, and that in itself can then lead to biomechanical problems, for example, impacting their performance or general feelings of tension and pain. We are not creating a mechanical change in length to those muscles or soft tissues around the joints. But what we do is that by touching and stimulating the skin, or by targeting the nervous system in some of our neuromuscular techniques that we will learn about, we are impacting on the nervous system. We're providing sensory feedback which the brain can then translate and change its output by reducing tone and improving range of motion. Aiding in the recovery process. The perception of recovery may be increased with an increased parasympathetic response from the nervous system. If someone believes the massage is helping them, and if they believe it feels good, their brain feels safe, their nervous system, then this may help them feel better in the days following increased activity or performance. But the research is unclear. One study from 2006 does show that there is some short-term benefit in the recovery process. But long-term and as a long-term answer for recovery from sport or intense exercise, the research is limited. Often touted that massage helps with lymphatic flow, but really there is very little research which backs this up. It was thought that massage creates the same kind of pumping effect that you get from contracting and relaxing your muscles as you walk and move. The lymphatic system, as we talked about in that module, doesn't have a pump like the heart to the cardiovascular system, but the movement of the body helps in terms of that movement of lymphatic lymph around the lymphatic system. Whether or not massage has any increased effect on this has not been proven scientifically. There are specific lymphatic drainage techniques like MLD, manual lymphatic drainage, or complex physical drainage, and they are specific techniques that require separate qualifications to be done. And these can be used, and there is some limited research in conditions like lymphedema or post-surgery to help with reducing swelling. Some studies show there's a positive effect, and others do not. So again, it's an area that's quite unclear when it comes to the physiological effects of massage. Heart rate regulation. Originally, it was thought that massage increased the circulation around the body, but many studies have shown that this is not the case. We do not impact systemic circulation. Circulation increases with movement, And based on the required demands of the body, then it changes the circulation to circulate more or less blood to the limbs or the middle of the body, depending on what's happening. So if a client is lying down and passive, then there's not much happening in terms of increasing that circulation. The metabolic demands of the body are quite low, and therefore we're not affecting the overall circulation of the blood around the body. You may have heard that we should always massage towards the heart, but these studies show that this is not the case. We're not affecting systematic circulation. So working away from the heart, for example, is not going to stop the blood flow or affect the blood flow negatively through the cardiovascular system. So although we won't affect it on that systemic or physical level, we do see a local response. So you often see a reddening, a flushing of the tissue around the area that you're working. So it may be that there's a local circulatory impact. But what we do see is that although massage is not affecting the systemic circulation, we do initiate this relaxation response or this parasympathetic response, which in turn can lower heart rate. Studies have shown that there can be an improvement on blood pressure, on diastolic blood pressure in adults with high blood pressure. And they also reported effects on anxiety and depression. And this comes on to the psychological impacts that we'll talk about of sports massage. Is it those positive impacts on anxiety, stress, depression that perhaps lower the blood pressure rather than being physiological? This is unclear. There's a lot of research around the benefits of massage when it comes to sleeping. Field and colleagues put forward a model as to why that works. And this is looking at massage therapy increasing levels of serotonin and dopamine, some key neurotransmitters in the brain which play a big part in sleep. So again, that is a model for why massage might help. But research has shown that massage improves the sleep in everyone from infants through to the elderly. It has also been shown to help improve sleep in people with certain medical conditions. Psychiatric problems, cancer, heart disease, clients with lower back pain, cerebral palsy and breast disease. It also helps in fibromyalgia, that chronic pain disorder which is popping up more and more in clinics. As we said, one of the main reasons clients will come to see you is to help with pain. And absolutely, there's plenty of research that shows that massage can reduce the pain levels in a client. There are many studies, especially with lower back pain, where it shows that massage can help reduce the pain. But what's interesting here is the window of pain relief. Massage alone can give short-term results in reducing pain, but long-term results often involves integrated modalities, so movement, strength work, breath work being key also to reducing pain. So a big takeaway here is that reduction in pain is about working with the nervous system. Pain is always an output from the brain. When the body is in danger, when the brain feels it needs to protect, it will output pain as a protective mechanism. And massage can help calm the nervous system, send those safety signals and help change the output. So what does this mean for pressure? Massage may cause tissue damage. If someone is working really deep in the tissue, you can get what's called post-massage soreness. This is a similar response to DOMS, or is also described as a mild rhabdomyolysis. Each client is different, and the first time you work with them, you don't know how they will respond. Remember, always communicate with your client, and always err on the side of caution and check in with how your client is feeling. Explain to them what we're trying to do. If the brain feels in danger, it will output pain. We're trying to help the brain and the body feel safe. So if we're working at pressure levels that are creating really big pain responses for clients, it is too much. For too long, sports massage has had this attitude of no pain, no gain. Well, we know now with the evidence that this is not correct. We want to make sure that our clients know we're there. They may feel a challenge, but that they can breathe through it and that their pain levels reduce as we work in the tissue, not increase. So what do we think is happening? So we're going to talk about the physiological and neurological effects of sports massage and what the latest thinking and the latest research is on why sports massage gives the benefits that we see. So, as we've alluded to in this module, the benefits of sports massage are clear, but the mechanism, the why it happens, is not clear. Mechanical, biomechanical, or is it neurophysical? Again, when sports massage was originally created, it was thought to be mechanical, that we were breaking down adhesions, mechanically stretching tissues, mechanically making changes to the soft tissues we were targeting. But what we know now is that these soft tissues are incredibly strong. The IT band often quoted as having the tensile strength of steel. So is there any level of pressure we would deliver through sports massage that would change something with the tensile strength of steel? No. But why does tissue soften? Why do we feel tension reduce? Why does the client feel pain reduce? Well, we know it's not mechanical because to apply the mechanical pressures needed would simply damage the tissue. So is it biomechanical? Well, what we see in many studies is that sports massage is unreliable. We may work in the cervical or neck region, but actually change the tension level and range of motion in the thoracic region, for example. The changes can be non-specific and also short-lasting. So then what's going on? Is it neurophysical? Are we simply sending messages, sensory input to the nervous system, where the nervous system, the most powerful hub within the body, then having the ability to change how something moves or feels? So sports massage is more than mechanics. So when we hear our clients say, "Oh, make sure you get that knot in my back," is it really a knot in their tissue, or are we working their nervous system? It's a thought bubble here, but really we need to explain this to our clients. Science even shows that by our clients understanding pain without even touching them, their pain can improve. So it's time we started re-educating our clients as to what's really going on. So the most modern proposed model for the physiological responses seen in sports massage has been put forward by the Biolowski paper in 2008. This is a neurophysical model by which it recommends all further research into massage physiology is based. This model suggests that manual therapies are a transient mechanical stimulus to the tissue, which then produces a knock-on chain reaction of neurophysiological effects. So yes, mechanical force is the input, mechanical stimulus. It can be very light, it can be varying pressures, but it's a mechanical touch to the skin. And what we see output from the nervous system is a neurophysical response, whether that's a reduction in pain, tone, improved mood, improved movement. And that may be what is going on at a physiological level. And this changes how we treat our clients. It changes how we apply our techniques, the pressures we apply, and also our clients' expectations. So let's look at the psychological effects of sports massage. Studies have shown that massage therapy can have a sizable impact on depression, stress and anxiety. If we think back to our nervous system module, we talked about the parasympathetic system and the sympathetic system. So that rest and digest versus fight and flight. If we think about the sympathetic system, that increased heart rate, increased breathing rate, muscle tone, these are often also symptoms of things like anxiety. So, if by slowing down, working in a massage, and stimulating and eliciting that parasympathetic response, that can lower heart rate, slow down breath rate, decrease pain and tone. So perhaps those feelings and that improved sense of well-being that you get after having a massage also helps reduce some of those feelings of anxiety and stress, for example. Again, why massage has this effect? Less clear. But again, it's leading itself towards this neurophysical view or model that we're now working towards. There have been some studies that initially found that massage can directly decrease cortisol, one of the stress hormones, but it's too difficult to prove as cortisol level changes over time and throughout the day, which makes a difference and a difficulty in monitoring and measuring these things when it comes to research.